Welcome back to our Impact Your Life channel in episode 3 in our pregnancy series, where we're going to be talking about low back pain. So if you're new to our channel and or this series, welcome. We will be uploading weekly starting at 20 weeks, discussing various topics of particular concern to pregnant women or women in the postpartum period. And I am Christie Amundson. I'm a physical therapist. I'm taking this journey with you. I am 22 weeks pregnant with my fourth pregnancy. And I have had many of these same struggles that you all do, and many of what we've covered already, including pubic bone pain, sleeping position difficulty, and low back pain, which what we're covering today, I have also experienced. So, first of all, I want to clarify what we're going to be talking about when it comes to low back pain for the purposes of this video. So, what I'm going to be referring to as low back pain for the purposes of this video is basically pain anywhere from right below your bra line to about your belt line or waistline. So anything in this region, whether it be in the center or it be on one side or the other or both sides or all the way across like a band, that is what I'm considering low back pain for the purposes of this video. I am not going to be discussing pain that goes kind of down into your hip or buttock region here, into your legs, like a sciatica pain, or into your sacroiliac joints, which are kind of like the joints in your pelvis, in the back of your pelvis here. So they kind of are in between this low back and buttock region. We are going to be actually doing a separate episode for those for pain in this SI region, and also a separate episode for sciatic pain. So for this episode, we're going to be just kind of sticking to pain between that bra line, belt line area. So why is lower back pain so common during the pregnancy and postpartum period? There's kind of three main reasons. The first is hormonal. So when we become pregnant, we have an increase in hormones, two in particular, progesterone and relaxin. And relaxin in particular is a hormone that acts upon your soft tissues, ligaments in particular, that kind of relaxes or loosens the ligaments. It is helpful when it comes to childbirth because it acts upon all the ligaments in your pelvis to allow your pelvis to spread apart when the baby passes through the birth canal, which is helpful for childbirth. However, it is, unfortunately, during pregnancy, that hormone kind of acts globally on our bodies and can kind of wreak havoc on other areas because it kind of takes away the stability that normally we get from our ligaments in other parts of our body, whether it be our back or our pubic area or our SI, even our knees, feet, shoulders, wrists. So that's the first reason. The second reason is more postural related. So normally our pelvis kind of sits upright and our back and our spine sits on top of our pelvis. Our back has kind of a natural curve in your low back. When we become pregnant and as we progress throughout the pregnancy and the size and weight of the uterus and baby kind of project forward, it tends to pull the pelvis forward. So it kind of tips the pelvis forward like this. And if you can see how that kind of bends the spine forward, and when it does that, to avoid walking around with your spine bent forward like that, your body will compensate by kind of increasing the arch in your lower back. So if you see on this model, when I do that, that kind of compresses the joints more in your back. It compresses, these are the discs in between the joints. It can compress the discs more unevenly. So the discs get compressed more towards the back. And it also causes the muscles in the back to really become overactive and really tight. So if I show you kind of on me what that looks like, if I have a kind of a more normal position, I have a slight arch in my lower back for my normal posture. And then when as I become pregnant and I become more further along, the weight of the baby will kind of pull me forward, and you can see how that kind of increases the arch in my lower back and compresses those joints, backs of the discs, and causes all the muscles throughout here to become very tight and overactive. The last reason that we often will get pain, lower back pain in pregnancy in the postpartum period, is more muscular, and that's similarly like what I was just talking about. When your abdomen grows, normally we get a fair amount of stability for our back and our core from our abdominal muscles. And as the baby kind of grows larger, it really stretches those abdominal muscles to the max and makes them relatively ineffective at stabilizing, or at least a lot weaker in their ability to do that. So we lose a lot of that muscular stability. So from the hormonal perspective, we're losing ligament stability. We're losing, from a postural perspective, where our bodies are being kind of pushed into a position that really compresses on our low back a lot more. And from a muscular perspective, we're losing the stability also of our abdominals. Not entirely, but certainly decreasing it. The postpartum period, your body has this once you give birth, abruptly changes all three of those things, and they don't reverse right away. So it's kind of like sometimes people in the postpartum period actually have more low back pain than they ever did in their pregnancy. And that is often because of how drastic the change is, in a matter of minutes or seconds. You go from all three of these things impacting you so greatly to them impacting you differently. So sometimes that drastic shift can cause your body to kind of reel and have more stability issues and problems. So in this video, I'm going to discuss kind of 4 different things. So first I'm going to discuss things you can do to your posture, like I was just showing you. Just little things that you can do while you're sitting or standing to adjust to help take a little bit of that pressure off. Number 2, I want to discuss if you are looking for a position that you can just rest, relax, take the pressure off your back in. I'm going to show you a good position for that, as well as if you're just, sitting at your desk at work or standing in line at the grocery store, a couple things that you can do, just quick, easy fixes. They're not really fixes, but something just to alleviate temporarily the pressure that you're feeling in your low back. And 3, I'm going to discuss some pregnancy supports or braces that can help take that pressure off. And last, I'm going to go over some exercises, which can definitely also decrease the pressure and pain that you're feeling in the low back. But it's, in addition to being a quick fix, it's also a little bit more of a long-term fix. So let's go. Okay, so first we're going to talk about posture. So we already talked about the fact that the weight of the baby in the uterus is going to pull you kind of forward. So it's going to pull your pelvis forward and stress your low back. So when you're standing, to counteract this, you can shift your weight more back on your heels. When your pelvis goes forward, it's going to want to push you to the balls of your feet or the fronts of your feet. So by putting your weight more on your heels, I don't know if you can see that, but it kind of takes a little bit of that arch out of my back. The other thing is we don't want to lock our knees for a couple reasons. If I lock my knees, it allows me, or it kind of puts a lot more of that arch back in my back, stresses my back. It also hangs on the ligaments in your knees, which are a little bit looser because of that hormone relaxin as well during pregnancy. So that does not mean we need you to stand with your knees bent, but try to just keep them straight, not locked. So if you keep them straight without locking them, and you put your weight back in your heels, try not to let your hips drift forward. If you see when I drift my hips forward, that also puts an arch in my back. So if you think about if you had an imaginary kind of like a pin and you put it in the side of your shoulder, in the side of your hip bone, and in the side of your ankle bone, you would want those 3 pins to kind of vertically line up when you're standing. You would not want this pin that's in your hip to drift forward in front of the other ones, because that would pull on your back a lot. So thinking about keeping your hips over your ankle bones or over your heels and keeping your weight in your heels. So if you can see the difference between if I lock my knees and do this, you can see how much more that arches my back or stresses my back versus if I just unlock my knees, shift my hips over my heels so that my weight is now over my heels. And that significantly kind of takes that arch or pressure off of my back. The other thing is, in addition to that, if you can imagine kind of tying a rope around your tailbone, and if you were to just kind of hang a weight from it, thinking about kind of letting your pelvis passively kind of tip down this way. If your belly projects a lot more, you could clasp your hands underneath your belly and kind of lift up a little bit. That's actually what a lot of the braces I'm going to show you today are doing. That can help just decrease a little bit of that pressure. We do not want you to have to stand where you engage your abs and tuck under like this, partially because no one stands like that, but also because your muscles shouldn't have to work that hard when you're standing and they'll just fatigue. So we want a low level kind of relaxing and a low level contraction, just where you're holding your body, but not to the point where you're really kind of maximally contracting or pushing yourself into a certain position. So it should feel like it's kind of just relaxed. So again, weight on your heels, knees unlocked, hips over your heels, and then trying to do that kind of just passive, like letting this drop a little bit. And you can see how that takes out a lot of the arch in my back. This becomes a little more challenging the further along you get. And again, you can use your hands to support if you need to. So if we're going to do sitting, so when you sit, if you sit a lot, like at work, at a desk job, you want to try to make sure, again, we don't want a huge arch in your back. So if you're in a firm chair, you don't want to be putting a big lumbar support or something that's going to be pushing you really forward into that same position that we were just talking about, because your baby already does that for you. So if anything, we want to take that out of there and we want to let your back kind of sink back into the chair more. So we want your lower back from that waistline to bra line to be pretty heavy on the chair when you sit. So it should feel like two things. It should feel like your pelvis kind of rolls back a little bit. It's going to roll back and the chair is going to stop it. So it shouldn't look like this, because the chair should be firm enough to stop you. So again, I'm going to roll back and the chair is going to stop me at a pretty normal, more neutral place. And then the other thing to try to do is trying to let your chest or ribs drop down. Again, as the baby gets a little bit bigger, it is going to push up against your ribs, want to lift your ribs up. But again, trying to exhale and just let your shoulders and chest kind of drop and not have, be walking around like this. Again, this not only puts pressure on your neck and shoulders as well, but it's going to put a lot of pressure on your low back and upper back too. So again, low back against the chair, roll it back, and then dropping here. You want your feet flat, and if you when you sit, if your knees aren't at least level with your hips, you will want to prop them up on something like a stool or a book. And when you do prop them up, this is going to be high for me, but I'm going to show you this. When you put them on something, you want to make sure they're flat. You do not want to put them like this on your stool where your heels hang off the end. You want your heels to be supported and your feet flat. So whatever you have, just make sure it's large enough that your whole foot can fit on it, especially your heels, like this. Now, you're not going to want to be up too high because it's just going to compress a lot and be uncomfortable. But we want your knees about level with your hips, if not maybe a tiny bit above your hips. What that does is going to help you kind of roll back and help your low back kind of roll into that chair and take the pressure off of it. I would not want you to sit on one of the wedges that go this way So obviously, if I sit and my butt is higher than my knees, or if I'm sitting and I curl my knees underneath my chair. This is popular, especially if we have like a desk chair that has the star type wheels underneath it to put our feet on the wheels of the chair. So like I have a stool here, like this, right? So people would oftentimes do this on their chair. Again, we want your feet flat, and we want your knees not to slope down like this, because again, when you slope down like this, you tend to lean forward on that pelvis. And we want your pelvis to be able to roll back to take the pressure off of your back. Okay, so along with that, I know I talked about giving you kind of some ideas for some quick fixes or quick relief positions. So when you're sitting in the same position, and if your back is really hurting and you're working at your desk or whatever, and you can't really get up and move around a lot, what you could do is just scoot forward in your chair a little bit. Allow yourself to really roll back all the way, so kind of slouch, and you're going to reach your arms forward. So you're going to blow out, and it's kind of like you're squishing or curling around your baby, and you're going to hold it there and breathe in and blow out. It should feel kind of a little bit harder to breathe if you're really tight in your back. So you'll only do it for a couple breaths and then take a break. But what this can do is it really stretches open those joints, and it stretches the muscles, takes the pressure off of them so that they aren't so unhappy. I would not recommend sitting, typing at the desk like this, but as a just occasionally, my back is killing me, let me scoot forward in the chair, do a couple of these, and you should feel your abs engage a little bit as you do that. So again, you're rolling your pelvis all the way back, reaching forward. Make sure your arms don't come up like this. So you can use that kind of as just a quick relief position. If you have the opportunity to lie down somewhere, so you're at the end of your day and your back is killing you, and you want something that gives you a little bit more lasting relief, what you're going to do is you're going to lie on your back. You do, if you're more than 20 weeks, you need to be up elevated. I know most people don't have this nice wedge, so use pillows, but just get yourself up at least 30 degrees. And then you're going to lie down like this, and you're going to put your feet on I know most people don't have this bolster either at home. You could use a cardboard box. You could use a laundry basket, flip it upside down, or a wastebasket, flip it upside down. You can also use, if you're doing this on the floor, you can lie down on the floor with some pillows, put your feet up on a chair or the couch or something, but they need to get up a lot. So in other words, if you look at me when I'm doing this, I want my thighs to be about vertical when I do this. And then, so this can feel good already. But for even more relief, what I can do is I can take a towel, and this is just like a thin bath towel. If I roll it up, and you may have to experiment with how big this is, but if I lift my butt up and I kind of put it under my really low tailbone butt area, it'll kind of curl me up even more. I would not want to put this up higher where it would arch me, because that would be the opposite of what we're trying to do. So again, it's trying to pull that pelvis up and take the pressure off of those joints and the muscles and give them all a break. And so this is a really nice rest position. You could read a book, or you could watch television. I would not recommend pulling your head up like this to watch television the entire time. So make sure you're in a position where your head can relax too. Or you can just kind of chill out and just rest and give your back a break. If your knees have a tendency to want to go out like this apart when you're doing this, then you would use a belt around them so you can still relax you're basically tying them together. And you can have them separated a little bit about hip width, but we don't want them to go out like this because that means your hips are going to kind of take more of the stretch instead of your back. If this doesn't feel comfortable, you can adjust the size of this roll or just take it out entirely. Obviously, if this doesn't feel like it gives you relief, then don't do it. But this is usually pretty effective in at least releasing some of the tension and the pain in your low back, again, at least on a temporary basis. Okay, so third, we're going to talk about some maternity supports for the low back area, or also known as braces. So the first one we're going to, again, these are 2 braces that we carry in our clinic. We're not endorsing them. We're not getting any kickback from them. They're just 2 options that we give our patients. We let people try them on here, see what feels the best to them. But these have been the 2 that we've used the most often, had the most success with. So that is why I'm showing you these particular 2. I will link them below in the comment section if you are interested. So the first one is called, it's made by Physician's Choice. It's a maternity mate brace for a lumbosacral area. So it has sizing. Let me just bring this up for you. It goes by dress size, assuming pre-pregnancy dress size. And it is adjustable for throughout your pregnancy. So it comes with 3 items in it. The first is kind of the belly pad. So you would put this low on your belly, and this is the part where it makes it adjustable because you're going to center this pad on your belly and you're going to just pull the Velcro around to kind of your level of comfort. Obviously, as you get further along in your pregnancy, you can adjust this back to make it less tight, which is nice. Then you have this larger piece. The larger piece makes a slight like V shape, and it has these Velcro things on the top, so that's how you know which way's the top. And you're going to put it around the back of you. And you basically you can do this standing up. You want to kind of put your weight even, and you're going to pull and Velcro. So you kind of want to pull diagonally down and Velcro. There we go. You could also do this lying on your back, so lie on top of this. You want the seam to be in the middle of your spine, but lying on top of it and pulling around if that's more comfortable for you. So you could wear this just like this. What it's basically doing is, like we talked about before, it's kind of like that lift, so it takes some of that pressure off of your low back. It comes with this strap, which is optional to use. The strap, there's Velcro on the sides. You'd put it here, and it's meant to go over the top of your belly. And this does kind of compress you together, so some people do not like that feeling, in which case you don't have to use a strap. But what it does help with is if you have a lot of rib pain or feel like your uterus is really pushing up into your ribs and organs here, this can kind of push back down a little bit and take some of that pressure off. So if you're someone who feels like that's one of the primary symptoms you have, this can actually help. Like, I personally kind of like this, but some people don't like the kind of squishing feeling. So up to you, but it's optional to use. So that's the first choice. It literally just goes around your back. The second, in contrast to the second choice here, which is called the Best Cradle Support. So this brace, I'm going to show you the sizing. It actually gives sizing for your pant size prior to pregnancy as well as your current weight in pregnancy. Okay, so again, I will link these below for you. So this kind of looks like a shirt. And it has their tag here in the back. So if you think about this is the back, and it does have straps, and the X, which would normally you would think would go in the back, actually does go in the front. So you would put this on kind of like a shirt. So I'm gonna put, again, face the tag toward me, put my arms in. This is fully adjustable as well. So I'm gonna pull this over my head, and I'm gonna pull it down. Now, you would not wear this over your shirt like I am showing you. You would wear it, you would wear like an undershirt underneath it. And same thing with the last one, and put it over the undershirt so it doesn't chafe your skin, and then put your clothes over it. This has a, it looks like bra clips. I'm just unclipping this so I can get it down. I lost it. Okay, so the X goes between your breasts. So it looks like this from the back. The tag would be centered. And then this strap is also adjustable. It has 3 different adjustments. And you're going to wrap that underneath your belly and clip it. Like this. So what I like about this brace is not only does it do kind of similar to that last one around here where it's lifting up, but it helps to just redistribute some of that pressure, and you can decide how much it redistributes by adjusting the straps here. So if I tighten these, obviously it would lift up more, but if I didn't want all that pressure on my neck and shoulders, I wouldn't have to tighten that much. The main difference between this and the last one is it has the option to kind of redistribute a lot of that pressure to other areas in your body. I wouldn't necessarily recommend this brace if you have a lot of neck and shoulder issues or pain. However, like I said, you can grade how tight you make these, so you can decide how much it kind of redistributes that weight. Of these 2 braces, I would say this is definitely probably the more popular one for our patients, because it has that option to redistribute the weight, but you don't have to necessarily use it, because if it does bother my shoulders and neck too much, I can really loosen this up, and then I'm still getting the benefit of the belt around my low back. So those are the 2 braces that we use here the most. And now I'm going to show you some exercises that can help alleviate your back pain as well. Okay, so last we're going to talk about some exercises. You can use these exercises for just a quick relief, but also they're a longer term fix for helping to retrain and strengthen, stabilize some of the muscles that combat that same position we've been talking about that's pulling you forward into having more stress on your lower back. So those muscles that we're going to be focusing on are gently with your abs. Again, your abs are kind of overstretched and they are weak in that position. So we are going to be activating them gently, but we don't want to be doing, really tough maximal crunches and things like that. And then the other muscle that can help pull your pelvis back the other direction is your hamstrings, which are the backs of your thighs. They come up and kind of attach to that butt bone, which can pull down this way and take that same pressure off of your low back. So those are the 2 main muscle groups we're going to be kind of targeting with some other stabilizers with these exercises. Again, these exercises should feel good to you. They should feel like it's relieving to your back. If you feel like you do them and they don't relieve your back pain, or they are making it worse or causing other discomforts other places, then I would not do them. But here are some options to try. So first, I'm going to give you some different position options. So first is going to be on your hands and knees. So if anyone has done yoga, this may look familiar, like the cat stretch in yoga. You're going to be on your hands and knees, your shoulders go over your wrists, and you're going to round your back by pushing your spine up toward the ceiling. And so not only are you going to be pushing your shoulders kind of down and caving your chest up, but you want to tuck your tailbone under. If this bending your wrist bothers your wrist, you could do this with your elbows on like the couch or a box, so that you're here resting with your elbows and doing the same thing as opposed to bending your wrists. So you're here, you're going to round your back, tuck your butt under, and you're going to shift your weight a little bit forward. By shifting your weight forward, it engages a little bit of your hamstrings. You may not actually feel that as much, but you should feel a little bit of abs. And then you're just going to hold it and breathe. And when you breathe, you do not want your shoulders to come up toward your ears. You want them to stay down, but you want to try to feel like your back kind of stretches and expands. And you may feel this even more in your upper back than you do in your lower back. And again, depending on how short a breath you are, like me, you may only be able to tolerate doing it for a few breaths and then relaxing. But what you don't want to do is go up, down, up, down, up, down in repetitions. You want to hold that position and breathe so that those muscles can accommodate to the new position. So, and that we're kind of retraining them in that new position. So that's the first one. The second one is standing up. So if you're somewhere, your back is killing you, and you have the ability to back up to some wall, you're going to back up to the wall. You're going to walk your feet out a little bit. And I want to walk my feet out far enough that I can put my weight on my heels with my knees just a tiny bit bent. So I do not want to be on the balls of my feet, but I also don't want to be way, way out like this. So far enough that my knees are a tiny bit bent. I don't need to be like a wall sit. Tiny bit bent, but my weight can stay on my heels. You can see that there's this gap in my lower back. I want to eliminate that gap. So you're going to tuck your butt under. So the bottom part of your tailbone kind of curls off of the wall a little bit. And your lower back should feel like it flattens into the wall all the way. And then you're going to reach your arms kind of down and forward gently. And as I do that, my upper back will kind of curl off of the wall. But I should feel like this is kind of like a C shape or a curve. I don't want it to look like this, where I'm bending from my hips. So again, I'm tucking under and I'm kind of curling, so it should feel like I'm kind of pulling my chest and ribs kind of back toward the wall as my shoulders go forward. So again, I'm going to hold it. I'm going to blow out. I might reach a little bit further. I should feel my abs. I should feel my leg muscles. Blow in, breathe in, blow out. Again, I don't want my shoulders up in my ears. And I should feel maybe a little bit of expansion in my upper back when I do this. I do not want to be in a really deep squat when I'm doing this. That will put too much pressure on my legs. All right. And the last one, I'm going to move this table carefully over toward this wall. The last one, you're going to need to use a wall or the headboard of your bed. And you need that wedge I was talking about. And again, if you don't have this wedge, you can build yourself a little pillow wedge at home. Just make sure you're at about 30 degrees. And you want to be able to put your feet flat on the wall and be at a 90-degree angle with your legs. So I'm going to scoot down a little bit so that my thighs are perfectly vertical. I could put something between my knees here, like a ball or a towel roll, to hold on to it, but I do not want my knees to split apart when I do this exercise. So I'm here. Oops. All right. Now this is mostly for your hamstrings. So what you're going to do is you're going to plant your foot on the wall, feet, and you're going to press through your heels as you try to drag. So it's kind of like I'm trying to drag my foot down the wall, but they're not going to move. What's going to move is my knees are going to lift toward the ceiling, like this. So what's actually lifting my pelvis or tailbone up is my hamstring muscle. I don't want it to be my abs and my back just doing a pelvic tilt like this. So again, it's about pulling down. If this is too challenging, you could check and see if you're doing it right by taking your hands and feeling behind your legs. You should feel there's tendons on either side of your the back of your knee. They should feel like a tight rubber band. If they feel pretty soft back there, means you're probably not using your hamstrings when you do this. This can be a little tricky, but if you do it right, as you do it, you're going to hold here and breathe, and you're going to try to relax everything from the waist up. So for this particular exercise, I don't want my abs engaged, and I don't want my back engaged, nor do I want my neck or anything up here engaged. So you're going to breathe in and blow out. Again, it's a pretty small lift. I do not want to bridge all the way up like this or lift really high. If I lift really high, it can cause my back to hurt more because my back will have to stabilize then. So just enough to tip it, kind of like that relief position we talked about earlier, where I put the roll under here. And you're going to hold and breathe. If you feel like you can't engage your hamstrings in this position, you can start out by trying to put them on a ledge, like a chair. So put your feet on the couch and push down into the couch. That will be easier to start, but once you get the hang of that, try moving back to the wall, because this is going to simulate like the wall is the floor, and our hamstrings, we're retraining our hamstrings to work when we're standing up and our feet are on the floor. You're going to hold it, again, as you breathe, relax everything else, and then come down. All of these exercises you can repeat 4 or 5 times, cycles, but again, you're holding all of them for a certain amount of breaths or however long you can tolerate. Again, you don't want to do them if they bother you, but they are options for you. Hopefully that will help alleviate some of your pain. And if you can do them without pain, it would be good to do them like on a daily basis until you kind of get through the postpartum period where your hormones stabilize and your posture stabilizes and those abs can be retrained. All right, I'm going to show you one other, it's more of a stretch than an exercise, but I have to go over to the sink to show you. So let's go. Okay, so here I am at a sink. This stretch, it's really easy to use a sink. Just make sure it's bolted to a wall. So you can use the kitchen sink, the bathroom sink. It shouldn't be like a pedestal sink or something that is not attached to the wall because you're going to pull against it. I want you to face the sink. Your toes will point straight ahead. I do not want them turned way out. So they're going to point straight about hip width apart. Your fingertips are going to go into the sink to hang on. And then your weight's going to be on your heels. You're going to bend your knees a little bit. You're going to tuck under and kind of cave your chest in and back so that you're curving. And you're going to sit your weight back. So my arms are straight. I'm not bent like this. And I'm not really bent very much with my knees. I would not want to be really squatted down like this. And I also don't want to be bent forward at the hips like this, where my head is down and now I'm looking at the floor. So I want to keep where I can look kind of straight ahead. And you're going to cave in and back, tuck under, sink back, good. And then you're going to breathe in and blow out. And you're going to stay in that position. So you're going to try to maintain this kind of curve or C position as you breathe. So you don't want to lift up your chest when you inhale like this. Like that. That would be tightening your back when you breathe in. What we're trying to do is when you breathe in, kind of expand your back. And this, you may feel more of a stretch in your upper back. And you may feel it in your lower back as well. Weight stays on your heels. So again, come up. And when you You could do this at a sink like that. It's probably the easiest. If you're in the handicap stall, you can use the bar as long as it's sturdy. You also can use like a stair banister or a pole where you clasp around and you're pulling back like this as long as it's sturdy and doesn't bend or break. All right, so I hope that some or all of these things were helpful. And if you find that you try some of these things and your pain is persisting at a pretty high level or a constant level, I would talk to your provider, whoever's monitoring your pregnancy, so your OB, your midwife, or your primary care physician. And I would ask about the option to see a physical or an occupational therapist who specializes in pregnancy postpartum clients to help you out further, because you may need to be evaluated individually. Again, these are kind of one-size-fits-all exercises, which there kind of is no such thing. So if they don't seem to work out for you and your pain is really limiting you, I would talk to them and get evaluated individually. Thank you so much for watching. Please, if anything in this video was helpful, please give us a like and subscribe for more content moving forward. And I will see you next week. Take care.